Hello, everyone, and today I want to talk about this paper called Transfer of Intestinal Microbiota from Lean Donors Increases Insulin Sensitivity in Individuals with Metabolic Syndrome. So, metabolic syndrome is what is commonly referred to as, quote, pre-diabetes. These are people that have a little bit less sensitivity to insulin, and they are probably headed towards becoming diabetic, but they're not full-blown diabetic yet. I don't know why they did this study in patients with metabolic syndrome instead of just going straight to patients with diabetes type 2, but that's what they did. In this study, what they did is we studied the effects of infusing intestinal microbiota from lean donors to male recipients with metabolic syndrome. And 6 weeks afterward, they tested them for insulin sensitivity. So what they did is, let's scroll down here. If you look at this, for the obese subjects, they looked for people, these were the patient subjects with a BMI of greater than 30, or waist circumference larger than 102 centimeters, and a fasting blood glucose level of greater than 5.6 millimoles per liter. And then for the donors, they looked for someone with a BMI of less than 23, so that's very lean, and match for age and gender with the obese subjects. So then what they did is they infused them. They took gut microbiome from the lean donors and they infused them into the obese people with metabolic syndrome as one control. And then another time they took the obese patient's own gut microbiome and reinfused it into them. That's the control. That's the placebo. And so this is, let's look at the results. Did I miss it? Oh yeah, here we go, right here. So this is what we want to look into. Here's their baseline insulin sensitivity of the lean controls. So the lean controls had this little bar right here is the average. So the average is here. The obese patients, their insulin sensitivity is much lower right here. And then after the gut microbiome transfer, you see that it moves up to almost where the lean controls are. But if you use autologous, so they're just putting their own gut microbiome in, they start here, and after infusion, it does not change. So that, and the same thing is true with the liver insulin sensitivity. Here's the lean subjects, very high. Before transfer, after transfer, it gets closer to the lean subjects. If you do their own gut microbiome transfer, it makes no difference. So this paper basically shows that the gut microbiome changes the insulin sensitivity and kind of makes, by many measures, these people that have pre-diabetes into normal metabolic functioning. What they don't say is how long this lasted. They checked them 6 weeks after infusion, so at least it lasted a month and a half. And I don't know how much longer it lasted. I suspect that as long as they kept their previous diet, it would slowly revert back to their old gut microbiome. But that is not known from this study. But a very interesting study that shows that gut microbiome transfer at least seems like a viable treatment method for metabolic syndrome and perhaps for diabetes type 2. So something that probably needs to be investigated. The whole transferring gut microbiome feels a little icky to some people, um, but it does seem highly effective. All right, hope that was interesting for you guys. Thanks for watching.